Assalamualaikum doctors. In this video I am discussing clinical recall. Uh, uh, this patient, I enter into the room, they tell me examine the back of the patient. So I have given my mark sheet, I wash my hand, introducing myself. Hello, I'm Dr. Emma, one of the children and adolescent doctor in this hospital. I want to examine Ali. I'm taking the permission from mother. And after that I'm talking with Ali. Hello Ali, how are you? And which class are you studying? How old are you? So I'm making a rapport and engaging the child. Okay, he is engaging. After that I look at this his conditions, how he look like. I find that he is deformed. His cervical neck is very short, and these are I'm seeing his general condition. Is there any device attached, distress, everything I'm noticing. Okay, after that my examination is back. So first I want to watch his back. That's why look at his back, remove the back. So first inspecting the back. In looking, I am finding there is a kyphosis. From upper, I find cervical fusion of the cranial cervical fusions. Look at the neck, there is cervical fusions. And also, I on the back, I am looking, there is scar may be present, scoliosis, kyphoscoliosis, and spingal deformity. That is the scapular, one is higher, one is lower positions, short neck and short statures, and low posterior hairline. In inspection I'm looking, this is I look. Then I am going to see the temperature from the right side, left side, cervical, lumbar, thoracic. Okay, after that I feel the tenderness. So tenderness I am looking just on the middle of this vertebral column. Okay, then I tell him to just bend forward to see that the scoliosis, these are going to vanish or not. Then I am going to tell the Beighton score. I am showing him to touch the Beighton score. So here Beighton score is negative. Okay, then he look at me, look, feel. I want to see his movement. First lateral right side bending, left side bending, then forward bending and the back side bending. Flexion extension I do, and the twisting of the right side, twisting of the left side. I find there is limitation of joint movement. Okay, after back I'm going to the neck movement. First of all I tell him to the chin to touch the chest and look at the ceiling. So two movement, then look at right side, look at left side, then try to touch your ear, the right shoulder and the left shoulder. So these are also restricted. And three finger inside your mouth, put inside your mouth. Temporomandibular joint is also restricted, I find. And cranial nerve palsy can be present, cleft palate can be present. Then I am checking the power of the shoulder joint. Raise his hand, then place your hand behind your neck and behind your back, because I want to see the shoulder joint movement also. Then I tell him to lie down on the couch. I want to see the hip joint movement, and that is. And to complete my examination, I want to do the full MSK examinations, hearing assessment. These are. What is my presentation of this case? I examine Ali. Ali is an 11 years age old boy. In examination, actually, I find that he's well communicating, no distress, no device attached. And what I notice, he has cleft palate and cleft palate. On the also, I find he has in the back. If scar mark, I will tell that scar mark. I find scoliosis, kyphoscoliosis, and there is a spinal deformity. His neck is short, cervical vertebra fused, and there is a low posterior hairline. And on movement, joint movement are restricted, restriction of the temporomandibular joint. His ear is low set ears, and these are. So putting together, it is a case of it is a case of skeletal dysplasia. I will tell that. Skeletal dysplasia on top, it can be Klippel syndrome, which is an autosomal dominant disorder. And there is a mutation in the GDF3 and GDF6 genes. Autosomal recessive if mutation in the MEOX1 gene. So this is my presentations. Then after that, how can I manage the case? I will revise my note, take the history. I will check that what are the investigation already done or not. do the diagnostic genetic testing and FRT lab, that is functional reach test, then predicting the falls in the older adults. Okay, radiology I will do echo because they have a VSD, ultrasound of the abdomen for kidney abnormalities, X-ray of the spine to determine the degree of scoliosis angle. Spirometry if scoliosis causes restrictive lung disease. Sleep study for obstructive sleep apnea due to short neck may cause cor pulmonale, and hearing assessment due to short neck and obstructive sleep apnea. So what are the tests I am doing? First of genetic testing I am doing because of it is a genetic disorder. Then according to lab we are doing FRT, functional reach test. We are doing scoliosis, geometry, spirometry. For short neck we are doing sleep study because obstructive sleep apnea can be present, and echo we are doing as VSD. Abdominal ultrasound we are doing because renal or kidney abnormality present. X-ray of the spine to determine the degree of scoliosis angle, and hearing assessment. Management plan, I will involve the multidisciplinary team, that is orthotherapist. Orthotherapist, cardiologist, nephrologist, pulmonologist, ENT, lies with the school for bullying issue and transportation, psychological support to the family. Differential diagnosis, Klippel syndrome and Noonan syndrome, Turner syndrome, these are. So this is all about back examination of the Klippel syndrome. It is an autosomal dominant or recessive, both. Thank you.